Thanks for agreeing to talk to us this morning, Mel. As you know, it's Mental Health Awareness Week. This year, I guess more so than ever, Mental Health Awareness Week is important. But why do you think that we need to discuss mental health again this year and raise the profile?
Well, mental health and physical health are never discussed or haven't been in the past discussed in the same space. They should always be. If I physically break my arm, break my leg, everybody knows that, but people don't see what's going on in somebody's individual mind, in their bodies, in the way they're thinking. And absolutely, that is absolutely equally important as anything else. So we need to recognize it. We need to be honest with people. We need to talk. We all throughout our life will have times when we're in crisis. Every single one of us will have times when we struggle. We'll have times when we sit there and think, crumbs, okay, I've got to get up again tomorrow. I've got to keep going. And it's really important that we share that, and we share that with other people.
So, Mel, why do you think it's important that that as senior leaders we open up and we talk about mental health?
There's a huge stigma about mental health, and actually, what we need to do is try and help people to understand there is no stigma to this. It is just part of life. As a leadership team, we need to be open and honest. We need to be able to say to people, we've struggled at times and we've been able to talk about it. Mental health should not be something that is hidden. The more you hide it, the worse it gets. There is lots and lots of help out there. And often just opening up when you're having a bad day is absolutely okay. There's no failure in that. There's nothing there that says you're weak because you do that. It's actually you're stronger when you do, because actually you can get the support you require. So for me, it's really important, both as a senior leadership team and as a county council, we actually start to say to people, it's fine. Talking is good, and you need to continue to do that. There's nothing wrong with that.
I just wanted to ask, what's it been like to be a director of adult social care through a pandemic?
It's been tough at times. There is no doubt about that. A new role for me just before the pandemic, and also a new deputy director team sitting alongside me. We've had to be honest with each other. We've had to talk. We've had to understand that some days have been really tough, that each of us, including me, have had days where you've thought, crumbs, what else can we do? There are times when we've been tired, when I've been tired, when the rest of all the team, yourself and others, have found it tough from time to time. And so I think for me, it's been about sharing some of that, being honest with people, but also for me, thinking through what do I need to do for my own mental health? Because you've got work and you've got home, and how do you sometimes manage that balance?
And when you reflect on the pressures that staff have been under, it's obviously been a really difficult year for everyone across the board in adult social care. And does that play on your mind?
Of course it does. And I think it plays on your mind to think, what else can I do? What else can we do as an organisation to help people? I think all the well-being information that's been out there has been really good. And Dave, you've been heading that up for us from an adult social care perspective. We've gone through a pandemic, and as you go through a pandemic, I think you will go through a really tough year and a bit now. You get resilient to it, but as it starts to come to an end and you go back to whatever normal is, I think sometimes now is the time that it's going to hit people more, because whatever that normality is, I haven't played golf for a year. Well, I couldn't most of it, and I still haven't gone back. And I asked myself why. And the probably why is because I've then got to get back out there and get on with life. And that's going to, it's good because that's what we need to do. But I bet people are thinking, crumbs, how do I do that now? Because if I'm thinking that, I'm sure others are thinking, okay, so let's get back out. Let's get back out seeing friends. Let's get out seeing family. And that balance has got to shift. And we've just got to be mindful of that. People are tired. People are exhausted.
And one of the themes of Mental Health Awareness Week this year is about the great outdoors. And we're obviously very lucky in Somerset to live in a beautiful county. So that there are opportunities, as you say. It's good that lockdown's easing towards the summer. So for many people, going outdoors is a way of supporting their mental health and mental well-being. You mentioned golf. So what do you do to relax and unwind?
Walking has been a real pleasure for me. Seeing the dogs jump in the water to swim, to whether it's freezing wet or not, actually, it gives you some pleasure. You're out there in nature, and I think that's been really important. Only last weekend, people were out sitting where I walk in the fields. They're sitting by the river, and you see big families doing that and playing in the river. And I think it's changed. People are seeing nature in a very different way because they've had to and because they've needed to get out. I just hope that continues for everybody. I will continue to do that. I will actually get out on the golf course and meet my friends again. But actually, what has helped me during that period is the ability to go out, to listen to nature, to be part of it, and gives you time for your brain just to cool down a bit, to think differently. And I think that's been really important.
Do you think maybe for some staff, looking back over the past year, eventually, once the difficulties ease, there'll be a sense of accomplishment of, we've achieved this together?
Absolutely. And I think we have. And I think the one thing that I'm absolutely proud of is leading a Somerset team that have worked extraordinarily hard, that have really worked for the people of Somerset, have really worked with our providers and all care staff across the sector, whoever they are, with our health colleagues. And I think through adversity always comes an ability to be positive and an ability to take the really good out of it. And we can't lose that. So for me, I think, people have worked extraordinarily hard. They're tired, but they will come out of it and think, crumbs, I was part of that. People did save people's lives. They work with families, they work with people, they help people. And I think that's the bit that for me is really important. And we can't lose. And we need to celebrate that at some stage. We need to celebrate the achievements.